Feeling stressed, overwhelmed? It's time to unstress your life and focus on controlling what you can control. I'm Dr. Ron Ehrlich, host of the Unstress Health podcast, inviting you to join the Unstress Health community and discover a holistic approach that helps you more effectively face the daily challenges of our modern world and effectively recover each and every day. Unstress Health is here to provide you with advice and support that is independent of industry and influence, an influence that's easy to miss but difficult to ignore. Our focus is on building mental fitness. Your mind can be your best friend or your worst enemy. Mental fitness is the key. Our three-phase approach targets mindset, boost your positive intelligence quotient, and move from self-sabotage to self-mastery. Secondly, the challenges. We redefine what stress means in our modern world. And thirdly, recovery. Master the 5 pillars of health. As a member of the Unstress Health community, you'll turn obstacles into opportunities with expert-led courses, curated podcasts, personalised health assessments, a supportive community, and much, much more. Join Unstress Health today, and together, let's not just survive, but thrive. Click on the link below or visit unstresshealth.com. Well, today we are exploring integrative medicine. Well, actually, we're talking to a legend. My guest today is Professor Avni Sali. Now, Avni is the founding director of the National Institute of Integrative Medicine, which is located in Melbourne, in Victoria, and was established in 2009. Now, previously, Avni was the founding head of the Graduate School of Integrative Medicine at Swinburne University in Melbourne. In the past, he was also head of the University of Melbourne Department of Surgery at Heidelberg Hospital. Yes, his background is in surgery and oncology, but basically Avni is a legend in healthcare in Australia. I had the pleasure of first sitting in a lecture theatre with Avni over 30 years ago and found his lectures to be not only incredibly informative and inspiring, but very entertaining as well. Avni has been in healthcare for over 50 years, so he shares some really interesting insights into who is predisposed to illness in general and cancer in particular, and they are insights which may surprise you, but or maybe not. Look, I hope you enjoy this conversation I had with Professor Avni Sali. Welcome to the show, Avni.
Nice to talk to you, Ron.
Avni, you are the director there of the National Institute of Integrative Medicine, and I know your background is oncology as well. If someone was diagnosed with cancer, as many people are, and they were going to go down 2 different routes, one would be the traditional allopathic chemotherapy, radiotherapy route, and the other might be an integrative approach to cancer. How would those 2 approaches differ?
Well, I think it's important to point out that it's been clearly shown that a healthy cancer patient will do better than an unhealthy cancer patient. In fact, you could virtually apply that to any illness. If you've had pneumonia, or if you've had diabetes or do have diabetes, or you've had heart disease, the healthier you are, the better you will do with those illnesses. And this definitely applies to the cancer patient. So therefore, the integrative approach becomes really mandatory, really, in being able to manage a cancer patient in the best way.
It almost sounds like a contradiction in terms when you say the healthier patient, because the diagnosis of the disease kind of implies they're not healthy.
That's right. Well, it is. That could be a bit confusing. But on the other hand, what we mean is the person sleeping normally? Because you can have cancer and you can either be sleeping or you may not be sleeping. And quite commonly, you're not sleeping well. And we know that to be as healthy as possible, you need to be able to have adequate sleep. So then we can move on to diet. If your diet is not healthy, well, we now have got so much information that you're clearly not going to do well, whether you've got cancer or not, if you've got a poor diet. And but you can go through the exercise component, the stress aspect. So all of these things that help make you as healthy as possible are also the factors that help improve your prognosis with cancer.
I mean, it seems so logical. I mean, it's almost too simple, and
Yes.
yet, it's not the experience that a lot of people who are diagnosed with cancer has, is it?
And you're completely right. In fact, it is, I can hardly ever remember a patient being asked about their sleep, about their diet, about their exercise. And really, and we now know that scientifically, that to have the best prognosis, you need to make yourself as healthy as possible. There are other, because people start thinking, oh, is he having intravenous vitamin C? Well, sure, that can be another factor. But even before we look into specialist type areas, you basically just have to improve the general health of the patient, and that's really very important. It is interesting that a lot of integrative doctors think that is not, even that is not completely essential, but it is essential. So if you can just make your patient as healthy as possible, you then start offering them the best possibilities of doing as well as what is possible. Then, of course, there are all the additional extra things that you can do.
But there's this comes to a fundamental question about what causes cancer, because a lot of people will get a diagnosis of cancer and they'll ask their doctor, how come? And I would imagine 9 times out of 10, the doctor, at least traditional allopathic approach, would say, it's just genes, there's not much, what you're doing is not making much difference. It's just genetic, unless, of course, they're a smoker. If they're a
Yes,
smoker,
yes,
well, there is a reason, but
yes.
otherwise there's not. What's your response to that?
Well, look, it used to be thought that it was all the bad genes, but now predominantly it is all to do with lifestyle. I mean, genes matter nearly all the time, but not to a major effect for most cancers. And for example, we know that if you live in Japan, you don't get prostate and breast cancer. But if Japanese go elsewhere to a Western type lifestyle, they get prostate and breast cancer just like the locals. So we've got the answer for most cancers, and how important genetic factors are compared to lifestyle factors. One of the most powerful and important things in cancer is, are you a sensitive type person? And this is my broad experience in this area. I've been interested in the mind-body medicine for a long time. And really, the way you are feeling and the amount of stress you've got plays a major factor. Now, the amount of stress that you've got depends on how sensitive you are. For example, politicians, I don't have the figures for this, but I'd really like to have the figures. They rarely get cancer. It's not to say they never get cancer, but they are generally not the most sensitive people, because they wouldn't be able to cope with their work. They'd have to resign after the first week. People throwing rotten tomatoes at them and terrible words and saying bad things about them. And so hence you naturally don't attract the most sensitive types. But you can see there are differences in them, that some are sensitive. I mean, for example, let's look at Mr. Trump. He doesn't come across as the sort of person who's going to be giving up because someone's going to throw a rotten tomato at him, even if whatever they do. So there are different personality types, and the most vulnerable one is the sensitive one. And I see this now for over 50 years. I basically don't see an insensitive person getting cancer. But there is the other bit, is that what do you do with your stresses? Now, we do know now that isolation is about the most important risk factor for disease and longevity. And in December 2018, the British Prime Minister Theresa May appointed the world's first minister for isolation because of the British culture being basically, we've got it here in Australia. We are predominantly British culture, but it's a mixture here because we've had so many immigrants who brought in different cultures. And see, people talk about the Mediterranean diet, and I say to people, it's not the Mediterranean diet because they're together. There's people around, whereas in like typical, like our culture, even though it has been diluted, isolation is a major factor, and this has been measured and it's well recognised. And mental health problems are really high in this country, and isolation again ends up being a key factor. Plus the too many rules and regulations. I mean, if I was to drop in and knock on someone's door at 9 o'clock at night, they'd probably call the police. So, whereas in the Mediterranean type climate, they'd all be clapping to say, oh, they couldn't have someone knocked on the door.
Yeah.
So the business, the ability to have someone to share your problems with is really important. Firstly, if you're sensitive, and then if you don't have someone that you can share your issues with, then that really puts you at a big risk, in particular in cancer. And I very rarely see an exception here.
Wow.
That's why, in fact, probably it's one of the reasons why I have been working with cancer patients, because they're generally pleasant people. They're not the sort of people who come in and tell you off.
What an interesting observation.
You know,
I've never, I mean, given your experience there, as you say, 50 plus years, I'm guessing, 50 years of
yes,
that's a really big statement about the type of, I mean,
it's
and I
really,
agree with you, but I think it's
but
incredible.
it's really very important in relationships too. And you see this, that the cancer patients usually require the more sensitive person, and their partner will be a more extroverted type, control type person, like don't do this, more than, rules and regulations, which is what a sensitive person doesn't need that. And in particular, if you're living in like a British culture that we mainly have in this country. See, the British, when appointed, I don't know what the Minister of Isolation has done ever since they've been appointed, but it was a very good idea. And clearly, Theresa May was able to do it because there is the evidence that isolation is now the most important risk factor if you haven't got someone to talk to. And when we look at Mediterranean, well, my parents came from a Mediterranean country, and I understand that very well. There's people all over the place, and there's not that many rigid rules. Don't do this and don't do that, and etc. Some people say that there should be more rules in some of these countries. But if you look at the people that survive the best and do have better longevity, they're basically places where they're living more at ease, less pressure and stress, and they've got people around to talk to. And they don't live in big monster cities.
Yeah.
Big monster cities are not really the way to go. I mean, it's ridiculous here in Australia. We have the biggest cities per population virtually in any place in the world, and the rest of the space is unoccupied.
I mean, there's an irony, isn't there, that we are surrounded by people and yet we can be so easily isolated.
Yes, yes. Now, to try and have someone that you can have a coffee with or have a drink with on the weekend, just like that, not easy. You know,
which kind of begs the question, because I know NIM, the National Institute of Integrative Medicine, where you are, is the home of the biggest lockdown. I mean, this is about reflections from a pandemic. I mean, talk about isolation, talk about public health measures, talk about mental health problems.
Well,
How do you reflect on that? I mean, you think it's pretty
I will
obvious.
look. I really just have to turn to Sweden, and Sweden virtually didn't bring in lockdowns, and Sweden just handled it just like any other infection, and they have got basically the best results. And it's not referred to
Yeah.
often as it always should be referred to. Compare it with the others who did something different, and they did something different. And lockdown, of course, we're finding that it has had so many negative consequences that has isolated people even more, especially in these British culture type countries, where you know, may not be communicating with others very well at all. And so I really find if you're sensitive and you've got no one to talk to, you could be at high risk, in particular for cancer.
Hmm.
I'd like to do that study on the politicians too.
Yeah, that's kind of intrigued me there.
Yes, yes.
I
I mean, you know, you do hear 2 or 3 times a year that a politician got cancer, but it's very rare because 50% of the people get cancer,
yeah.
and
Wow.
and I can understand why they don't. And I
What
don't think Trump is going to get cancer this year.
No, no, no. But listen, this we coming back to how we started that there are, being healthier, really simple things make the biggest difference. What is that just not intellectually stimulating enough for the medical profession to take seriously?
I find it very disappointing. It can be very stimulating just to get to know the person and talk about their life, and it can be quite rewarding because people can do these things. They're not complicated and they're not difficult, and they're expensive. You see, but um, and they all can be done, and then you can move on to other more complex things like look at the details of diet and. We do have the metabolic approach, which is becoming more popular, and that quite a good book has been written for the public by a physiotherapist from the UK who did have cancer that spread, and she was told that they couldn't save her, but she went ahead and saved herself. And a book's called How to Starve Cancer, and it's basically based on reducing the carbohydrates. And the other one that seems to be important in the metabolic area is the low density lipoprotein, the bad cholesterol. And it's possible that you could improve your prognosis just by reducing your calories and improving your LDL cholesterol. So you can get down to details, and hopefully you could make a difference. Theoretically, it would appear that you do make a difference, but we don't have conclusive results. But it's very likely to be beneficial for other conditions as well, of course, by reducing the carbohydrate and reducing the LDL cholesterol. It is important, though, that there are problems even, and it's called the keto diet, that one high protein, high fat, and low carbohydrate. But there are parts of that diet that aren't so healthy. In fact, legumes don't score so well, and they're profoundly important for our microbes in our body, and they're very healthy foods anyhow. So basically, that needs a modification. The strict keto diet would not appear to be very healthy. So that you can get down to details that may be of benefit. One of the problems that we do have in doing research, I mean, firstly, the culture of health is a drug culture. So really, the pharmaceutical industry benefits most when we've got more sick people.
Hmm.
Healthy people are really the worst thing you could ever have, which is a bad way to start. Really, if we depend on sickness to be able to for the pharmaceutical industry to do well, then it is a real problem. So it is a bit of a drug culture. But of course, drugs are very essential, and when used correctly, they can be very beneficial. But it's a question of firstly making the person as healthy as possible. They'll then deal with their drugs, because the conventional cancer treatments is basically chemotherapy and radiotherapy, and more recently we've got immunotherapy. But all of those treatments are quite toxic. And unless you're healthy, this is another reason why you need to be healthy, just to cope with these toxic treatments.
Avni, I think people will have heard a lot about chemotherapy and radiotherapy and obviously surgery. But immunotherapy, you've mentioned it, you've just thrown that word in there. And I wondered if you might just give us a little bit of immunotherapy 101. What is the theory behind immunotherapy?
Well, in the natural medicine and integrative medicine, it's always been the approach that one of the reasons why we try and make the person as healthy as possible is to improve their immunity. And the reason why you need adequate sleep, immunity. The reason for exercise, again, immunity. So all of these factors help improve the way your body defenses work, which are also very important in the attack on cancer. With the immunotherapy drugs, they can improve the immunological response. In many instances, they can improve it so much that people have even developed autoimmune illnesses because the immunity is a bit too active and can attack areas of the body. And so therefore, immunotherapy, when is used with medication, one needs to be has to be very cautious as to how much immunostimulation you create in the patient, because that can actually lead to many side effects. And so, but it is about making the immunity better, and we've seen very impressive results in, for example, spread of melanoma, which is one of the cancers that is very closely linked with immunity. But things like kidney cancer, lung cancer, and several other cancers. And in fact, there's hardly a cancer now where there isn't a trial somewhere, even pancreas cancer, where immunotherapy is being trialed.
And is it a medication, or is it taking an element of the body's immune system and turbocharging it?
No, these are specific drugs that have been developed.
Right.
And now the refining of these drugs will be, I think, a big part of the future treatment as such. But it's taken a long time for the pharmaceutical industry to move away from just chemotherapy and radiotherapy, and now using immunotherapy, which is more scientific in a way, because that attacks the cancer. But again, we've learned that it can be toxic, because if you make the immunity too active, then that can do damage as well.
Hi, Dr. Ron here, and I want to invite you to join our Unstress Health community. Now, like this podcast, it's independent of industry and focuses on taking a holistic approach to human health and to the health of the planet. The two are inseparable. There are so many resources available with membership, including regular live Q&As on specific topics with special guests, including many with our amazing Unstress Health Advisory Panel. Now, we've done hundreds of podcasts, all worth listening to, with some amazing experts on a wide range of topics. Many are world leaders. But with membership, we have our Unstress Lab podcast series, where we take the best of several guests and carefully curate specific topics for episodes which are jam-packed full of valuable insights. So join the Unstress Health community. If you're watching this on our YouTube channel, click on the link below, or just visit unstresshealth.com to see what's on offer and join now. I look forward to connecting with you. And I think this is coming back to the idea of slash, burn and cut a cancer out versus harness the body's metabolic or immune function.
Yes.
And this comes to mitochondrial function, which kind of leads into a whole story about the importance of sunshine and light, our relationship with light. This has
Well,
changed a lot. What is your thought
well,
when you hear
you
someone
see,
tell
I
us,
hardly ever would see a cancer patient who's had their vitamin D measured.
yes,
Vitamin D, we can't live without sunlight. And of course, Melbourne is the cloudiest major city in Australia, one of the cloudiest in the world. We've got the Great Dividing Range that stops all the clouds as they come from the west. And if you look at typical winter here, we hardly ever see the sun. And it's interesting that in Scandinavia, Scandinavian countries, they add vitamin D to the foods to ensure that people get enough vitamin D, especially during those 6 months where there's very little sunlight. And vitamin D is an absolutely essential nutrient for a patient to do well. And to treat a cancer patient without doing their vitamin D, well, it's unlikely that you're going to get the best result if they're going to be vitamin D deficient, which almost most of the time they will be.
I
Very
mean,
important.
in terms of a public health measure, the demonization of the sun has got to be one of the most illogical and dumb public health measures
Yes,
ever. Would
it
you
is.
agree with that?
Oh, yes, look, there's some very basic things with the sun. The sun is good,
Hmm.
but it's very important to wear sunglasses. The two
Okay.
commonest main diseases of the eye, cataract and macular degeneration, the commonest cause of blindness, are predominantly due to the sun. But if you wear sunglasses, you don't get those conditions. You,
Interesting.
you really need to make it a routine to wear sunglasses at all times when you're out in the sun.
Wow. Okay. I
And
that's an interesting comment because we did a program with somebody with Chris, oh gosh, he's an ophthalmologist and he was out,
yes,
Chris Canove, and he was talking about macular degeneration as a function of seed oils. And,
yes,
a lot of these so-called vegetable oils, sunflower, safflower, canola, that these processed oils were the greatest threat to macular degeneration. I'm
yes, especially
surprised.
especially if you don't wear sunglasses.
Okay, you're very keen on the sunglasses. I know
Well,
there's,
I'm 83, and I have worn sunglasses certainly for the last 40 years all the time. And I
right,
don't wear glasses for reading or anything either. But we know scientifically that it protects you from developing a cataract and also macular degeneration. It's such a simple thing. It's just a habit of getting to wear sunglasses.
interesting. But you get out in the sun quite a bit, Avni, I imagine.
Look, in winter, I do take a vitamin D supplement. But
Okay.
as we've learned, you see, with the vitamin D, I find this very interesting, that all of a sudden we've had studies looking at osteoporosis using calcium, using vitamin D, and they were never very conclusive. And they'd forgotten all about K2, because K2 puts your extra calcium that you might absorb because of your vitamin D into your bone rather than your coronary artery or your aortic valve. And so K2 all of a sudden over the last year has come alive. And clearly, if you've got osteoporosis, you need to be taking K2
Hmm.
and vitamin.
Interesting to hear you pull out K2 because Weston A. Price, a dentist from 100 years ago,
Yes.
was talking about activator X, the X factor, which actually turned out to be vitamin K2.
Yes, 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 and it's uh, very important that if you're taking vitamin D, you need to be taking K2 to ensure that, because see, one of the things that is becoming an epidemic is calcification of coronary arteries and calcifications of aortic valves, and K2 seems to be a very important factor in trying to prevent that.
Now, Avni, you're the National Institute of Integrative Medicine, NIM. Tell us a little bit about it.
Well, we I after I was head of the surgery department at the Heidelberg Hospital for the University of Melbourne, and a lot of the things that I was doing weren't that popular. I did some of the first nutrition research in this country in the 1970s, starting off with the eating habits of primary school children. And people be talking to me and say, "Are you still doing surgery, or are you just looking at the kiddies' eating habits?"
Mm-hmm.
You know, we started some of the first nutrition research work in this country, and prior to that, well, even now, it is ridiculous that you can basically do medicine without much nutritional teaching at all. And I mean, as I do say this to my patients, it's probably better talking to your next door neighbour about nutrition than your GP.
Mm.
And the other thing is that the way people are rewarded financially, that plays a big part too, as to what type of medicine. And people talk about 6-minute medicine. In other words, the prescription's written and off you go.
Mm.
And we do have, it's only, I find it disappointing that about 2 weeks ago, I see on television that they discovered that having antibiotics when you're a baby increases your risk of asthma. That's been known for years, that it destroys your microbes. And unfortunately, Australian babies have more antibiotics prescribed during their first year than probably most in any country in the world. And these infections are viral, so therefore antibiotics should not be used, and because they do so much damage. And so understanding that is really very important. I went on after the difficulties at the University of Melbourne to set up the Graduate School of Integrative Medicine in about mid-90s at Swinburne University. I was able to do it because they didn't have a medical faculty. If they had a medical faculty, there's no way I'd be able to do it. There was still a lot of resistance, you see. But we eventually did do that. And the Vice-Chancellor was really very supportive, and he was probably, as far as I can see, one of the most active Vice-Chancellors in Australia. And he was so excited to be able to have such a school which would improve the education of doctors, but also the health of Australians. But he retired after about 10 years, and the rest of the university wanted to kill us. And like the engineers and the scientists, they thought that we weren't scientific enough. So it's quite interesting, and because we live in a drug culture. And culture is so strong in people, and it can play a bigger part in what people do and who they are than most people realise. So we eventually had to move from there, and we did set up the National Institute of Integrative Medicine, which is quite unique in the world as far as we were a charitable institution, and we do research, and we've got the biggest integrative clinic in this country, but probably one of the biggest in the world. And we're involved in education as well. But it is difficult, and we're very active in research. And the fact that we can say that without getting 1 cent from the government, we don't get any research from the government. Well, the major health bodies like TGA is predominantly funded by the pharmaceutical industry. So therefore, there's going to be a bias there, and I don't think that should exist. And we have that with the government too. But when you look at who's giving support to the political parties, well, it's the people who've got the most money, and we don't get any support from the government. I suppose they're being very smart. Why support us? Because all we do is make people healthy. And that's not good for the industry. As I said before, you need sick people, not healthy people, which is stupid, really. But there's no way that the public want this. And we now know that 70% plus or so of the Australian public are looking for health medicine. And that's what basically supports us. But we do probably more significant clinical research work here to do with the whys, whether it be cancer, blood pressure, heart disease, and a number of other conditions, memory, for example, memory loss, Alzheimer's. We're involved in numerous studies using laser in the treatment of prostate cancer. We've done a pioneering study here where we can show that we can treat prostate cancer with laser, and with which could lead to avoiding prostatectomy. And it's a very, very, very useful treatment. So the research in the area is very important because it can offer a better way to treat illness. And the lasers proved to be very, very interesting, and we're doing quite a few interesting studies, like you can lie in a bed that produces laser light, and that can penetrate the skin. It won't penetrate to treat deep cancers, but all the cancer cells circulate, and we measure circulating cancer cells. It's a French technology, and we can show that by using the laser, we can reduce the circulating cancer cells. And one of the areas which we'd really like to look at, people have thought always that because of manipulation of the cancer during surgery, then you're likely to increase the circulating cancer cells, but it's never been measured. So we plan to do that because we can measure the circulating cancer cells. And so during surgery, you're increasing the circulating cancer cells, most certainly, but also the surgery itself, because it depletes the rest. For example, humans can't make vitamin C. Bats and guinea pigs can't either. So at the end of a, say, 2-hour operation, you've virtually got no vitamin C. So your immunity doesn't function properly. It also, I believe, and I noticed this about 40 years ago, but I haven't been able to do the study. We've actually got the study ready to do. We're just waiting for some funding, which would change the way operations have been carried out throughout the world. That you give vitamin C during or at the end of surgery in order that you allow the immunity to function properly, but also you protect the brain, because the brain can be damaged very easily when you run out of vitamin C. Easy, and it's quite simple, and it's a non-toxic treatment. And but we think that this could also be a very important time for determining whether or not you're going to get a spread of cancer, because you're mobilizing these cancer cells during the surgery, but your immunity is down. So therefore, if these cancer cells are going to survive, this is an opportune time for them to survive, because the immunity is down, because first they've got no vitamin C, and also the stress and the trauma of the operation is immunosuppressive. So we think that this light beam study that we've been doing has got huge potential immediately after surgery, because you've mobilized these cancer cells, but we can destroy those with laser. And so it's really very exciting work.
And when you say laser, what are we talking about? Low energy laser or red light? What sort of laser?
Yes, it is the low energy. It is the light. And it's a light bed. You lie in it for half an hour.
Okay.
And during that time, we think, but we'll find with further experimentation, that we've already got preliminary data that show that we're destroying the circulating cancer cells, and assuming that the circulating cancer cells are going up as a result of cancer manipulation during surgery, then this would appear to be a very useful thing for virtually any cancer patient to have.
Now, you mentioned circulating cancer cells, and it's reminded me of a program we did over a couple of years ago with Dr. Joachim Fleurer, who I'm sure you're very familiar with.
Yes, of course.
And Joachim has been very involved in this circulating cancer cells.
Yes.
This is a way of measuring, well, cancer activity in the body, isn't it, really?
Well, really, look, it is so important, because really I've seen, for example, a prostate cancer surgeon operating on some TV star and said, "We got it all, here it is." We got it all. You got all of the cancer that was in the prostate, but unfortunately, you haven't got the cancer cells in the body because they're the ones that are likely to cause trouble in the future. And that's why it's so very important to have a healthy body to deal with these circulating cancer cells, or even using the laser treatment, which we're using now to destroy the circulating cancer cells.
And the light bed is another kind of focus on actual metabolic health, isn't it, really? I mean, that's really what the focus is on, to stimulate mitochondrial function. Is that a fair?
Well, the mechanisms, of course, you sensitize the cancer cells to the laser, to the light, particular light, and that the normal cells don't take up the sensitizer, and hence the cancer cells become sensitive to the laser light, which can actually destroy the cancer cells. So it is really, in principle, a very, very, very good treatment to be looking at.
And is measuring circulating cancer cells an accessible tool to be using?
Look, it's been done by, in particular, the French for over 15 years, and there's many articles that have been published. I find it interesting how it has not been able to be more popular. In fact, you'd hardly ever hear of anyone talking at an international cancer conference about it. But to me, it seems that for the future, better care of cancer patients, it will become an essential part of the care of a cancer patient.
You've also mentioned a couple of times that we have a drug culture, and the disease is and I've often said it, that our current health system is a great economic model. It's just not a very good health model. And part of the problem really is, and I think the British Medical Journal did an article on this not that long ago, about the role of key opinion leaders and product champions in very senior positions in our health system. Is that your observation as well?
Oh, yes, I think that seems to be relatively true. Well, if you're a key opinion leader and you're running big business, you want them on your side.
Avni, we're going to have links to NIM, and so people can learn more about what integrative approach to health is all about. I just wondered if we might take a step back before we finish up and just say what we're all on a health journey as individuals in this modern world. Taking a step back from your role in medicine over many years, and the fact that you've been on that journey for 83 years, what do you think the biggest challenge is for individuals on that health journey through life?
Well, I think the culture that you live in is very important, because as we are now recognizing that isolation would appear to be the most important risk factor for disease and for longevity. So therefore you need people around you, and you don't need all the extra stresses. I mean, technology stresses about speed limits. Look, it makes a lot of sense, but if you're constantly stressed about the speed that you're driving at, they're important, of course, but they're all factors that are increasing the stress, and on the other side, you're isolating people because of the culture that we live in. We need backup. We need people around, and we already have this information on studies. I mean, there's been a TV program recently that went on for about 4 weeks, and they looked at longevity factors, and they basically come back to the fact that, have you got people to talk to? Can you go for a walk? Can you have some sunshine? What's your diet like? And if those things are pretty good, then you can do quite well. In particular, though, if you're sensitive, you need to have someone to unload with, to share your problems with. And there's some very good evidence for that. For example, in breast cancer, it's been shown if you've got one confidant, you improve survival by 15%. If you've got two confidants, two close friends, you improve your survival by 25% with breast cancer, just by having these two close friends.
Wow. Well, Avni, thank you for sharing your knowledge and wisdom with us. I first heard you lectured first to me over 30 years ago, and I always found you so inspiring, and it's such a pleasure to have you on the program. Thank you so much.
Thank you very much, Ron. Thank you. Thank you for the good work that you're doing. Thank you.
Thanks. Well, there it is. Avni obviously is quite a character and has an incredible wealth of knowledge and experience in healthcare, oncology, and in the field of integrative medicine. I mean, he is one of the leaders in Australia, if not globally, on integrative medicine. And look, we don't have to agree with everything that everyone says, and I'm not sure I agree with Avni about sunglasses, but that's a whole story in itself. The point being, as the world we live in becomes increasingly more complicated, the solutions are remarkably simple, accessible, sustainable, and most effective, and most important, effective. And what an interesting idea. The healthier you are, the more likely you are to recover from an illness, even when that illness requires therapy, intervention, chemotherapy, surgery, or whatever. Trying to be healthy. And this is also interesting because often, and I've heard this so many times over 40 years of my own clinical practice, that when people are diagnosed with a serious illness, they will often reflect on it as one of the best things that's ever happened to them if they survive. And that is because it's forced a reevaluation of their life and their lifestyle, and they're focused on being healthy. And that is really the empowering message of this podcast. It's an empowering message of the integrative medical field, but it's an important message of the Unstress Health community as well, which I would encourage you to join. I hope this finds you well. Until next time, this is Dr. Ron Ehrlich. Be well.
Feeling stressed, overwhelmed? It's time to unstress your life. Join the Unstress Health community and transform stress into strength. Build mental fitness, from self-sabotage to self-mastery. And together, let's not just survive, but thrive. Expert-led courses, curated podcasts, like-minded community and support, and much more. Visit unstresshealth.com today. This podcast provides general information and discussion about medicine, health, and related subjects. The content is not intended and should not be construed as medical advice or as a substitute for care by a qualified medical practitioner. If you or any other person has a medical concern, he or she should consult with an appropriately qualified medical practitioner. Guests who speak in this podcast express their own opinions, experiences, and conclusions.